One of my favorites, this is what I was saying, Laurie knows, one of my favorite things is data collection, right? Because it's really hard to figure out where we need to go if we don't know where we are. So, under the Affordable Care Act, as well as sort of other initiatives of the department, U.S. Department of Health and Human Services is collecting more data on which of the following population demographics. Population demographics just meaning characteristics of different groups of people in order to help reduce, in this particular case, health disparities. Under the Affordable Care Act, HHS, the Department of Health and Human Services, is required to collect data on 5 different categories of identity that are frequently correlated with health disparities. Those are race, ethnicity, sex, disability status, and primary language, meaning the language that you speak pretty much at home. On the state level, yep, we're getting there. We're getting there. And under the Affordable Care Act, they left this open opportunity for the Department of Health and Human Services at the national level to include other characteristics as well. So HHS has included sexual orientation and gender identity. They put out a plan in 2011 talking about how they were going to roll out questions about sexual orientation and gender identity on their national surveys. Now, as you pointed out, there are national surveys, but there are also a lot of surveys that happen at the state level. So the first step that HHS did under this provision was to add a sexual orientation question to the National Health Interview Survey, which is sort of the big flagship health and demographic survey that the department uses. However, the place where gender identity is really moving forward is actually on the state level. Has anyone heard of the Behavioral Risk Factor Surveillance System, the BRIFIS or BRIFIS? Yep, some hands. So that is what you're referring to really with the sort of, when you look at the state level, the BRIFIS survey is the one that tends to be the one that's most used to get a sense of what are the health profiles of the populations in the different states. There is now a sexual orientation question and a gender identity question that states can choose to use on their BRFSS surveys. Right now, 17 states have said that they're going to do that. Interestingly, Wisconsin has been collecting data on sexual orientation for some years now. I don't know where they are in terms of taking up the specific new gender identity module, but I just want to underscore to your point, it is up to the coordinators of these surveys in the states what questions get asked. So there is an opportunity every year to work on getting more questions about LGBT status, LGBT identity, added to these surveys. So you can find information. Are folks familiar with Fenway Health in Boston? It's a federally qualified health center, which means they get financial support from the federal government, but they focus on LGBT population health, and they have an institute that provides a lot of information about data collection in particular. So that is a really great resource, and I don't have the website link up there. Looking at the Department of Health and Human Services, speaking of data and resources and stuff to read, I'm a total geeker. I love my acronyms. Which of these acronym-heavy divisions of the Department of Health and Human Services have actually recently put out new stuff to read, or at least to put under your pillow at night? That's what I do. It soaks up. Any ideas of who here has been talking about LGBT health lately? That is correct. These are all major divisions of HHS, including obviously the National Institutes of Health and the CDC, all of the above. In particular, this is from a report, it's called the National Healthcare Disparities Report. It is mandated by Congress that the Agency for Healthcare Research and Quality, these people, put out a report every year that talks about the quality of healthcare in the United States and identifies disparities. In 2011, AHRQ, for the first time, included LGBT populations in that report, and they specifically focused on transgender populations. The way that they did that, because there's not yet enough data collection generally about transgender folks, right? I've never had to respond to one of those surveys. I'm like, where is it? Somebody ask me. They actually turned to Injustice at Every Turn. Are folks familiar with that report? Anybody? Yeah, Injustice at Every Turn. Have you heard of that particular report? It's from the National Center for Transgender Equality and the National Gay and Lesbian Task Force. They put it out in 2011. They asked over 6,400 transgender people across the country about their experiences in a wide variety of areas of their lives. And the findings, not surprisingly, were exactly. So what AHRQ did is they took the findings from the health section and they literally put it into their report. That is important, not only because they're recognizing, right, that this is a real issue, real data that needs to be reported out, but it is another step in helping us build this library of resources where we can actually point to and say, it's not just us who's telling you this over and over and over. Not that you should need any voices aside from trans people's voices to tell you what the concerns are. But having language like this in a congressionally mandated report about health disparities is a really huge step in building that evidence base that talks about where we are, what the problems are, so that we can figure out what are the policies that we need to help change that. So I don't want to read it all out, but I would just note, so this is a government report, mind you, mandated by Congress, talking about too often policymakers, service providers, the media, and society at large have dismissed or discounted the needs of transgender and gender nonconforming people in their communities. And a paucity of hard data, there we go, on the scope of anti-transgender discrimination has hampered the struggle for basic fairness. So all of these different resources are all available online. I'm happy to help you look up any of them if you think that any of them would be helpful in learning more about what has been said on the national policy level about the experiences of transgender people. So to your point about the states, does anyone have an idea which state's Department of Health actually has an LGBT resources page? Anyone else? Wisconsin. The Wisconsin Department of Health, or Health Services rather, has long maintained an LGBT health website. And it's even updated on a fairly regular basis. So this is, I accessed this today. This is not a Google cache. This is not something I've been keeping on my computer since the Walker administration started. This is new and fresh today, talking about, and there's a whole bunch of resources down here. You can see here this first link, General Resources, the Center of Excellence for Transgender Health. So it's not a website with links to disgusting reparative therapy or anything like that. It actually pulls together some of the very latest and greatest resources about not just trans health, but LGBT health generally. Which just goes to show, right, that sometimes the states that we think of as the best for LGBT people, nothing. And sometimes you find things in places where you least expect it. And that's not to say, again, to your point, that this necessarily fixes anything, right? This is an information page. So what's going on the policy level, the politics level is entirely different. But it is just important, I think, that it goes to show that there can be surprising things in some interesting places. So, true or false, the National Institutes of Health state, wow, grammar nerd, mistake. Don't report me on that transgender health is among its research priorities. Yeah? False? I heard it false. Feels kind of false. It's actually true. This is from 2012. I apologize that you can't really see this very well. But NIH has stated that both transgender and intersex health issues are among its research priorities. This is Dr. Larry Tabak, the number 2. He was speaking at a Pride event in 2012 saying NIH has opportunities for advancing LGBT health research on the effects of, just to read it out so you have a sense, the effects of smoking, depression, cancer, aging, obesity, alcoholism, all of the things that we know are correlated in many cases with LGBT disparities, and transgender and intersex specific health needs. So this is one of those things that, again, not a lot of people know about. So NIH has been trying over the last couple of years to get more research going on LGBT health because they know that they don't have nearly enough. The issue, of course, comes back to one of pipeline, preparation. Who is ready to do this? It hasn't been long enough, really, when you think about it, that there has been an accepted career path, if you will, in transgender health research. So that is something that NIH is working on changing, because when NIH says we want to do research on these things, students start being able to focus on that, schools start being able to focus on that, and it starts to grow into the kind of body of people and work that actually can help advance knowledge around LGBT health. Another big transgender health priority that I wanted to note, the Affordable Care Act created a new big funding mechanism for doing research into what's called patient-centered care. If you ever want to talk to a medical provider or somebody who's geeky about health policy, about why they should care about trans health, patient-centered care, that's the buzzword. So a trans person, as a patient, needs to be the focus of what's going on and needs to be taken as the priority in the interaction between the patient and the provider. And that wasn't always the case, right? Too many instances even now, right? I've certainly been in many of them where it's the provider who's driving the whole thing and I'm just, kind of feeling run over. Patient-centered care is now being supported by something called PCORI, the Patient-Centered Outcomes Research Institute. I mentioned this last night, and I don't know if you were in the room at this point, but this institute is supporting a major study on the effects of gender transition-related services, treatments, including surgeries for transgender people. And it's actually being done. Anyone know which state? You don't get to guess. Anyone know which state this is happening in? Georgia. So talking about health insurance coverage, which is, of course, one of the biggest focuses of the Affordable Care Act, foci, 1 in 3 LGBT people in this income range, the range in which people are now eligible for subsidies to purchase coverage, or in some states, eligible for Medicaid, was uninsured in 2013. This is from some research that we did at the Center for American Progress last year. Does anyone know what is that income range where folks are eligible for subsidies or Medicaid? A? Other ideas? It is actually A. That big range between 0 and 400% of the federal poverty level, that's where folks can get Medicaid coverage in some states from 0 to 138%, and then subsidies from 139 to 400. When we did this research, this is again before the full implementation of the Affordable Care Act, 34% of LGBT people in that income range were uninsured. If we want to look specifically at where trans people might fall in that, this is from some research that was done in Colorado. You can see here, this is general LGBT, so that's comparable to this sample, right? This is LGBT altogether. This is just transgender. You can see the incredible gap in the availability of employer-sponsored coverage. You can see the really huge segment here of folks in the Veterans Health Administration. And up here, this big orange chunk, 27% of transgender people in this sample in Colorado saying that they are uninsured. So with regard to the Affordable Care Act, the Affordable Care Act envisions expanding coverage, insurance coverage, in 2 main ways. Does anyone know what one of them is? I mean more like what's the architecture of the system that you would get coverage through? The marketplace, that's one, and the other one is Medicaid. Right. So the Affordable Care Act said, okay, we're going to do both public and private coverage expansion. Before the Affordable Care Act, how many people in this country did not have insurance coverage? No, just generally, like anybody in this country, how many people did not have coverage before the Affordable Care Act? 50 million people, yep. In addition to an unknown number of folks without citizenship documents who don't have coverage. So the Affordable Care Act said, okay, great. Not great, bad. Let's do something about that. Public and private. The expansion of Medicaid was intended to cover, as I mentioned, from 0 to 138%. And then the subsidies through the marketplaces kick in 139 to 400. The Supreme Court decision in the summer of 2012 effectively made the Medicaid expansion optional for the states. So at this point, does anyone have a sense how many states have expanded Medicaid?
All but 15 or something like that?
Close. It's actually about 50-50. There are a lot of states that are not expanding, and unfortunately most of those states, I think I took off the map that I had up here, but most of those states are in that belt from Texas across to Florida and up to Virginia, where actually the largest number of uninsured LGBT and T folks live, predominantly in communities of color, predominantly parents. Right, so Medicaid, before the Affordable Care Act, Medicaid was really a problem for a lot of folks in the LGBT community because, for a couple of reasons. One, you had to be a so-called categorical eligible. You had to fit into one of a very few number of groups that were considered to be eligible, period, for the program. For example, being a pregnant woman. Then, once you were in a categorically eligible group, you had to meet the income requirements. And Rain, you've heard this again from yesterday, but I think it bears repeating. The states were able to set that income threshold pretty much as low as they wanted. So you had states setting these income thresholds incredibly low and making it almost impossible, even for someone who was otherwise eligible, categorically eligible, to get coverage. So Texas, Louisiana, Arkansas, some of these places, does anyone know how much a parent with 2 children could make before becoming ineligible for Medicaid coverage in, for example, Texas? You were there, you don't get to answer. Any other guesses? Single parent? Single parent, 2 children, Texas? Do you have a guess? $381 a month. Good luck. That is the situation before the Affordable Care Act. And for many states, as I mentioned, in that belt, particularly in the South, it is still the case. Because these governors are saying, we're not going to implement the Medicaid expansion. Frankly, we don't care, right, about how well people are doing in terms of their income and in terms of their health. Now, I'm not going to make any assumptions about what kind of feelings we have in the room about a certain governor in a certain state, say, Wisconsin. But one of the things that Wisconsin actually did before the Affordable Care Act was, as you mentioned, there was a program that made it possible, even for people who were single in some cases, to get Medicaid coverage.
It started in Milwaukee County.
Dane County, hey, I'm here in Milwaukee. I appreciate. The statewide program, Badger Care, right? What they have done, Medicaid has not been expanded in Wisconsin, but they have shifted existing Medicaid funds in order to make it possible for everyone making up to 100% of the federal poverty level to be able to get Medicaid coverage, again, regardless of whether or not they are categorically eligible. That is huge for LGBT people who previously, unless, again, they were, for example, a pregnant woman, could not get coverage no matter how low their income was. So now here in Wisconsin, 0 to 100 is Medicaid coverage. And as you mentioned, a certain number of people have been sent to the marketplace. 100 to 400%, those folks can get subsidies to purchase coverage through the marketplaces. It's about $11,400 a year for an individual. So, under the Affordable Care Act, as we've been discussing, each state has new health insurance marketplaces. As of April 18th, today, how many folks have gotten coverage through the marketplaces? There was a hand too? Yep, B. 8 million. So far, 8 million people have signed up for coverage through the marketplaces, including our friend here, Regina Gray. I don't know, do you know Regina? She works out at the GLBT Community Center in Denver, in Colorado, and she joined us for a recent meeting with Dr. Biden at the White House to talk about why the Affordable Care Act and getting coverage mattered for her. She was, when she transitioned, she lost her life, her marriage dissolved. She was on her wife's health insurance plan. She also has, in addition to needing transition-related care, she also has various other conditions that necessitated huge amounts of out-of-pocket spending every month for her. Before the Affordable Care Act came along, she was on the verge of selling her house in order to pay off her medical debt. When the Affordable Care Act came around, October 1, 2013, she went to the GLBT Community Center of Denver, which was a navigator, the Affordable Care Act, and said, can you help me figure this out? under the Affordable Care Act now, through that marketplace, she has a plan through the Colorado Health Insurance Co-op, which is a new thing created by the health reform law, that actually has no transgender exclusions at all. From its very beginning, it was created without any exclusions. So that is something that's pretty new, because usually when you have new products come on the market, they just take all of the exclusions right from everywhere else. We just get more of the same around trans exclusions. But in Colorado, in this particular plan, for example, she is able to get healthcare that she needs and does not have to sell her house. That's not to say that the Affordable Care Act is perfect, that the coverage that's available to any of us covers what we need, but I just wanted to highlight that there are opportunities out there for sharing stories like Regina's with folks who think that it cannot be done, right? Whether it's policymakers or an insurance carrier or what have you, to say, actually, you don't need to do the exclusions thing. Actually, you don't need to write transgender people's healthcare needs off, because it is entirely possible to have a viable plan that actually covers what people need and for people to actually be able to afford it. According to the US Department of Health and Human Services, my favorite place, clearly, the marketplaces cannot discriminate. On which bases?
US?
Yep, indeed. According to healthcare.gov, which is the federal marketplace website, discrimination is not permitted for a variety of bases, including sexual orientation and gender identity. This is on Wisconsin's marketplace application. It's at the end. When you go, it actually says, I understand, where you sign your name, I understand that under federal law, discrimination is not permitted on these bases. And complaints of discrimination, this is very important, can be filed by visiting the Office for Civil Rights at the US Department of Health and Human Services. This is the first time, under the Affordable Care Act, is the first time that we have had the ability to go to the federal government and say, I am being discriminated against on the basis of gender identity, sexual orientation, and you can actually file it and actually have a process of investigation begin under the Affordable Care Act. With regard to the law itself, because those are regulations about the marketplace, so that's not the sort of big law itself, that's specific to the marketplaces. But the Affordable Care Act itself prohibits discrimination against who in the provision of healthcare services, in health insurance coverage, by anyone accepting federal money, which is anyone in Medicare, Medicaid, pretty much everybody in the health system is touching federal money in some way, which means that the non-discrimination provision of the Affordable Care Act applies to them. Does anyone know what that provision protects? Indeed it is. Yay, Section 1557 of the Affordable Care Act. It's a very short provision, but basically what it says is that the protections of existing federal civil rights law apply to the healthcare system. These include the Civil Rights Act, so race, color, national origin, the Rehabilitation Act, which is HIV/AIDS status, the Age Discrimination Act, and Title IX. Does anyone know Title IX? What's the other sex non-discrimination law that includes gender identity protections? Yep. Title VII of the Civil Rights Act includes sex protections in employment. In April of 2012, the EEOC, the Equal Employment Opportunity Commission, ruled that those sex protections include gender identity. HHS has followed suit and says that these sex protections include gender identity. And we have just heard that the first lawsuit has been filed on the basis of gender identity under this provision. It's coming out of Illinois. Transgender woman who she'd been going to her healthcare provider for quite a while, went and said, I would like to start hormone therapy. The doctor said, I don't really have the expertise. I don't know. I feel kind of weird about it. No. And she said, this is really important to me. I need you to work with me. I need you to help me get my healthcare needs met. And eventually it got to the point where the clinic told her, we don't have to treat people like you.
Couldn't even get a referral.
Couldn't even get a referral. And before the Affordable Care Act, that was perfectly legit. Before the Affordable Care Act, it depended on the facility, really, and it depended on what the circumstances of your individual case were, whether you could figure out a way to, and you know more about your particular case than I do, but there was no national protection that said, regardless of where you are, whether you're in Wisconsin or Florida or Texas or California or wherever, a healthcare facility may not say things like that to you, may not deny you the care that you need because you are a transgender person. You know, I want to make sure that folks are aware of this, that all of you in this room are aware of this, and because that is one part of that process of making more people aware. Because we are not going to get anywhere as long as these protections just sort of languish in the law and no one knows about them. It depends on us, again, for better or for worse, because appeals, lawsuits, all of these things that are sometimes necessary are completely unfair that we should have to do this. Completely ridiculous waste of resources, really, when you think about what else we could be spending our money and time and attention on. But for better or for worse, a really complicated system. The only way it's changing is if we are standing there demanding that it do so. So this is one of those opportunities that we have to go and say, you know what, my needs were not met, and that's not okay. The Obama administration, true or false, has declined to support efforts to connect LGBT community members with new coverage options under the ACA. False? Anybody? I guess it's kind of a leading question. Guilty as charged. It is indeed false, because the White House and the Department of Health and Human Services are both partners in the Out to Enroll campaign. This is the meeting that I mentioned earlier, Dr. Jill Biden, Vice President Biden's wife, meeting with representatives of the LGBT community, folks who are gay, folks who are in a same-sex relationship, folks who are trans, folks who just couldn't figure out how to get coverage before the Affordable Care Act, and had something to share about the change that the law has made. This is outtoenroll.org itself. I encourage you all to check it out. Let me know what questions you have that are not answered there, because we do try to keep it up to date as things change. You can note down here, for example, what if I'm transgender? The US government is actively monitoring which major issue in trans health? The DSM revision, Diagnostic and Statistical Manual, the American Psychiatric Association, International Classification of Diseases revision, murders of trans people. It's actually E. Through the Department of Health and Human Services, the Department of Justice, and the Department of State, the US government is actively monitoring a variety of international issues affecting trans people, including the ICD revision and the murders of trans people that we know are incredibly prevalent, not only abroad, but in the United States, especially in places like Washington, D.C., and also in countries such as Honduras and in other parts of the US, such as Puerto Rico. Does anyone know what the ICD revision is? Yep, so the DSM was revised, what, 2 years ago, 3 years ago? To change gender identity disorder to gender dysphoria, right? As Dr. Fraser from the World Professional Association for Transgender Health says, no one's identity is a disorder. Thank you for that quote. So the DSM now says, whatever it says, gender dysphoria, fine. But there is another diagnostic framework that's out there. That is the International Classification of Diseases. And it is the basis for medical coding in most countries around the world, including here, even though we're one version behind the rest of the world, because we're very special here in the US. So the ICD now exists at the level of the World Health Organization in its 10th edition. It is currently being revised into the 11th version, and part of that revision is a discussion of, right now, gender identity disorder, transgender people, are in the mental health chapter, similar, obviously, to being in the DSM. The conversation that's happening now at WHO is that appropriate? I think many of us in this room would probably think that that's not appropriate, right? That it's not actually supposed to be or should not be in the mental health conditions category. So the question is, what happens now? If we're going to take it out of the mental health category or spread it around through the different categories, how do we do that in a way that makes sure to protect what we can of access to care and especially to coverage for trans people, while also helping to promote that idea that no one's identity is a disorder? So HHS is particularly interested in this. It's very unclear where things are going to end up. WHO is all over the place with regard to LGBT health. They've been trying to introduce actually a resolution in the World Health Organization to talk about the importance of LGBT health. And after 6 hours of extremely angry debate, the idea of discussing the resolution was pulled from the agenda at the behest, unfortunately, of countries that are very well known to be on the record as not believing not only in the human rights of LGBT people, but not even believing that LGBT health is something worth talking about. So that, again, is something that the US government is starting to take an increasingly strong stand on. Which of the following health insurance plans is presently most likely, and I'm going to ask you to bear with me here because there's a lot of nuance in this question, most likely to cover transition-related care? So right now, this is the landscape with regard primarily to marketplace plans. All of these states in green are those that have explicit insurance commissioner bulletins, so interpretations of state law, that say our state laws and our understanding of the Affordable Care Act do not permit the use of transgender-specific exclusions, like those, Ellie, that were used, presumably by whoever was talking to you about the marketplace plan, to say, oh, no, we don't cover that. These other states in other colors besides dark blue are places where there's a lot of activity going on. And then, unfortunately, and to your point, there's a lot of states that are still that dark blue, meaning that there is yet no explicit statement of policy or law in those states that says transgender people should have access to the same kinds of care as any other person, should be able to get hormone therapy, mental health services, and yes, surgeries, just as much as anyone else, because none of those procedures were really developed for super secret special unicorn trans people, right? We were a little bit of a latecomers to this whole medical field. There's a lot that was developed for example, soldiers. Ask the VA what they think about genital reconstructive surgery. You better believe they cover it because of the experience of soldiers being injured on the battlefield. When it comes to hormone therapy, birth control, that's a hormonal preparation, hormonal medication that pretty much any provider can see fit to prescribe. So when it comes to looking at trans people's healthcare needs, there is not some special distinction that sets the healthcare trans people need off from the kinds of healthcare that non-trans people need and get on a routine basis. So looking at the legal underpinnings for this, basically what this rests on is the idea of parity. Again, if you have a service that is covered for non-trans people, you have to make it available to trans people for whom it is medically necessary, right? The same criteria that you would use for anybody. Figuring out, though, how to tie that to non-discrimination provisions, that's the trick. Because if you ask me what I think gender identity non-discrimination in insurance means, I think it means no exclusions and no denials of care that transgender people need for pretty much any service, whether or not it's related to transition. If you ask an insurance regulator in Wisconsin that, I would imagine you'll get a different answer. If you ask an insurance company, you'll get a different answer. You have that experience asking the marketplace plan, do you cover this? We don't really know what gender identity non-discrimination in insurance means. What this is doing right now is building basically a dictionary of definitions for gender identity non-discrimination in insurance. California, Oregon, Colorado, Vermont, Connecticut, and DC have all explicitly said that gender identity non-discrimination needs to mean no exclusions. So Medicaid has a long history of trans exclusions, and actually it sort of started with Medicare. And the reason for that is it was put in 1981 on the basis of a single policy paper written by, does anyone know? Janice Raymond, right. Which book did she write? Transsexual Empire. And she was really active at the end of the 70s and the beginning of the 80s. And she fell in with a group of medical providers who didn't like trans people, didn't think trans people should have access to health care, and they literally pressured the Department of Health and Human Services, this again, the beginning of the Reagan years, the beginning of the HIV epidemic, a lot of backlash against sort of LGBT people or whoever people thought that we were at that time. And so Medicare instituted an exclusion in '81. And because Medicare is kind of the 900-pound gorilla of health insurance, whatever it does, a lot of private plans, Medicaid tends to follow. So very quickly after the imposition of this exclusion in Medicare, a lot of state Medicaid plans and a lot of private plans followed suit. So it has now been more than 30 years. A lot of state Medicaid programs still have those exclusions. And even for those that don't, it can be really hard to get transition-related care. I was very glad to hear about your experience with Medicaid here, because it can, even when there's no explicit exclusion, it can be hard to get coverage. Yep. I want to take a break, but I have two things that I want to say before we take a break. One is with regard to Medicare. So folks may have been hearing that there is, in fact, a process underway at the Department of Health and Human Services right now to revisit that exclusion. The preliminary finding has been that there is no scientific evidence to support it, so it is now under review for being eliminated entirely. We expect a decision on that actually sometime probably before the beginning of the summer. Knock wood, it'll be a good one. The second thing that I wanted to share, let's go into TMI place. Let's do. So I had a hysterectomy on April 1st. I went to a hospital in New York City, and I was not expecting good stuff. Because, you look like me, you call up the hospital, and you're like, hi, I want to talk to the OB-GYN department, and they're like, hold, please, can't deal. And then the next thing you hear is write a dial tone. This particular hospital has one person. It's a huge hospital. It has one person who has been working there for the last year and a half trying to teach folks how to work with trans people. Now, I've been now talking with that office, that hospital, for 3 months, 4 months. I have called them so many times at this point and talked with so many different people, and never once has anyone ever paused or questioned me or given any indication that my healthcare needs are anything other than what they would take care of every day. It's not that hard. All you have to do, as you all well know, but again, be prophets, go out, keep spreading the word. All you have to do is treat people like people. So regardless of what the person looks like, regardless of what my voice sounds like on the phone, regardless of what kind of healthcare I'm asking for, it's not that hard. Even though the systems may seem set in their ways, and even though it might seem complicated and confusing, this experience, this huge hospital in New York, again, working off of one person, has managed to change this entire institutional culture. That now somebody like me can literally call them up out of the blue, be like, hey, how you doing? I want to talk about something. And I actually get the healthcare that I need. So with that, if we can take a 5 or 10 minute break and then come back and discuss some questions.